The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul. And today I have Dr. Jared Chapman of Living Well joining us. Dr. Chapman, it is great to see you.
It's good to be with you, Shay.
So, Botox, we've talked about Botox many times and the fact that it's probably one of the most, if not the most popular procedures that you do there. And it's always been indicated for forehead lines, right?
Correct.
But now there are new indications.
Yeah. So Botox is on the move and to a new address, basically, which is no longer going to be in this part of the face. We're actually moving to the neck.
Wow.
So soon Botox will have the FDA approval for platysmal bands. So those stringy bands that you can see as we start to get older, where the platysma is this big, huge fan-like muscle that comes up, connects to the jaw. And what can happen is little bands can start to develop in that active muscle. And it just, it creates this kind of unsightly effect in this area for some people. And so now we're going to be able to actually go into those bands individually, inject them with a small amount of Botox and relax them so that the neck looks smoother.
Wow.
Remembering that the neck is probably the most neglected area of treatment.
Right.
Everybody treats
We treat the
this.
face. Right,
Yes, but
right.
then we leave our hands and our neck
Hmm.
untreated, and those are the most
True.
exposed giveaways for aging. And when we're able to kind of smooth the neck down, it just makes everything kind of a flow and connect so that we have this healthy aging effect from here all the way down to the clavicle. So it's a very nice effect too for the jawline, because when we relax this muscle pulls this area down. So when we go in and we relax this muscle, what we do is we get a little lift as well on the jawline. It still remains to be seen whether the FDA will say it's for jawline improvement or not, but we do know that platysmal banding should be coming soon as a formal FDA approval. And the great thing is we've been doing this off label with Botox for
Right,
years and years and
right.
years. But now we have studies that have been done to give us a proper dosing of this area, and also to show that there's safety and efficacy in treating this area. So again, I think it just makes the neck look nice and refreshed. It's going to sharpen the jawline a little bit, and it's going to be the first new indication for Botox in quite a while. The last FDA approval for cosmetic use was the lateral canthal lines, and so coming soon will be the platysma. So we're
The
excited.
lower half. So,
Correct.
and
Yeah.
again, I know that you have talked about before on the show here how you use it to kind of tighten this area,
Correct.
even on yourself. So,
Correct.
so
Yeah. I
you were
just had
ahead of
it
the
done
game.
last week. So yeah.
You were ahead of the
So
game.
that's right. So although Botox itself relaxes the areas it's going to, we like to say it's on the move to expand its FDA approval. So we're excited for this.
All right. Well, Dr. Chapman, thank you so much for being with us and sharing the exciting news. And we look forward to your next visit.
Thank you for having me.